These are more exam areas.
The Maua Methodist Hospital is a continued focus of mission work with a long history in Maua.
The British started the Maua Methodist Hospital in 1928. They came over the hills and they looked down here and they saw swampland. They wanted to build up on the hill. The tribal elders didn't want them to build on the hill.
It was the first time anyone had ever seen a white person. The word Mzungu means one who is lost and wandering, because they thought the British were lost and wandering who happened to end up here.
It was a swamp, and it's where bodies were placed.
And the word was Marua, and it meant bodies that disappear. And then it got shortened to Maua.
But they decided to put them down into the flatlands where the hospital currently is.
They filled it in, and they put up first a chapel.
When the British left in 1963, the Methodists took over. The hospital now serves 1 million people and is helping foster education and medical careers.
This is our nursing school. We have 125 nursing students. It's a 3-year nursing school. It's been ranked second in all of Kenya for its excellence, so we're very proud of it. About 45 a year graduate.
But this hospital does not have some of the amenities of what some call fancy hospitals, meaning a government hospital.
Patients cannot leave without paying their bill. People generally don't have national health insurance. It costs $35 American dollars a year. Most people cannot afford it. The average income is $400 to $500 a year for most families. We take the clothes from our patients. They're running around in hospital garb, and if they try to escape out of our fenced-in 19 acres, then the guards are everywhere, all over the compound.
Some stay as long as 3 months, but sometimes it can be an act of love and charity to help families leave the hospital.
Esther, who has a 2-year-old named Ronnie was sick, but he's been cured for 6 weeks now, and so he's bored out of his mind. There's no television, there's no books.
It was the 2014 Oregon, Idaho team's funds that became this family's ticket out of the hospital. When told Esther and her son could go home, tears and smiles were shared among staff, knowing it was the mission gift that made this possible. Sometimes making it to the hospital may be a major challenge. There is no ambulance service, so patients may just be dropped at the front door.
Sometimes they brought them in on a pickup and they slide them off the end of the pickup and they dump them at the administration on the street, and then they take off, and so the guards are there to make sure a nurse is contacted.
It's a balancing act to provide care and maintain a budget.
There is a service fund, is what we call it, and it is the general fund for the Maua Methodist Hospital, where salaries are paid oftentimes from that. One of the things Jim did as a new CEO is he made sure people got paid on time. That's the first time in 4 years, but it means we didn't pay our drug bill.
And some of the necessary services come with an emotional price.
This tent here is for HIV testing, and when you find out you have HIV, sometimes you'll hear screaming and wailing. This just gives a little privacy.
But the Maua Methodist Hospital continues to reach out into the community, using every resource it's provided to educate in the hospital and beyond its walls. The major battle on the front lines, AIDS. But donations are helping provide treatment for pregnant mothers, spouses, and children. In some cases, the drugs may be provided for free.
We are able to bring smiles back. We are able to bring hope. We are able to bring encouragement. We are able to bring people back to the productive, useful work in the society. Together, we can give our people hope. And even seeing children being tested, mothers coming and they're going home with care, I can't tell you how thankful these patients are, because they would be 6 feet under. But today they are alive and well.
In the maternity ward, smiles are guarded.
They don't give their children names for a month because they usually die, and so they save the names till they're sure the child's going to live.
But shared blessings are welcomed.
We ask that indeed the Spirit of Christ make these babies grow, that they may grow into the fullness of the life that God intended for them, and that the mothers and the families will be filled with joy as they watch this child grow into a full human being.